Hi, I'm Juliana Rollero and I'm going to talk about arteriovenous malformations of the brain. First, I'm going to define what are arteriovenous malformations. There are defects in the vascular system in which arteries are directly connected to the veins without interposition of a capillary bed. Arteries carry oxygen-rich blood away from the heart to the rest of the body tissues and cells. Veins return oxygen-depleted blood to the lungs and the heart. Capillaries connect the arteries and the veins, and the presence of an AVM disrupts this vital cyclical process. I'm going to show you a video in which you will understand this topic better.
Arterio refers to the arteries, which are the blood vessels that take blood away from the heart, and venous refers to the veins, which carry blood toward the heart. Mal means badly, so an arteriovenous malformation, or AVM, is some sort of bad or abnormal formation between the arteries and the veins. Typically, oxygen-rich blood is carried to the body's tissues via arteries. Large arteries split into smaller and smaller arteries and feed into capillary beds, where cells exchange oxygen for carbon dioxide. The capillaries then feed into larger and larger veins, which carry deoxygenated blood away from the tissues. Normally, arterial blood is under a high-pressure system, and as it goes through smaller and smaller vessels, ultimately into the capillary bed, pressure in the vessels becomes significantly lower, and blood drains into the lower-pressure systemic veins. So this capillary bed dampens the arterial flow a bit. With AVM, this whole capillary bed isn't there, and a group of arteries directly link up with a group of veins instead. The vessels in the AVM can start to tangle up and are called a nidus, which is Latin for nest. When a single artery and a single vein link up abnormally like this, it's called an arteriovenous fistula. In AVM, the arteries and the veins are both under high systolic blood pressures, because there are no capillaries to dampen the pressure, which means that the AVM can expand in size over time and can put pressure on the surrounding tissue. This pressure on surrounding capillaries can pinch them shut and prevent that functional tissue from getting blood flow. Also, the high pressure causes the arteries supplying blood to dilate, while the veins thicken and undergo fibrosis. Vessel walls are also prone to forming aneurysms, which are these balloon-like protrusions. And because the vessel walls are weakened and stretched out, they're also at risk of ripping and tearing.
Okay, now we will define AVMs in the brain. That is a tangle of blood vessels in the brain or on its surface bypasses normal brain tissue and directly diverts blood from the arteries to the veins. Here's a video of an AVM in the brain. Here is normal flow. No connection between the arteries and the veins. But here we can observe an AVM, where blood diverts directly from the artery to the vein with no capillary interposition. With an increased blood pressure, which affects normal brain tissue. Okay, if we talk about AVMs applied to medicine, we can say that it may not cause any signs or symptoms until it ruptures, resulting in a bleeding in the brain. In about half of all brain AVMs, bleeding is the first sign, but some people may experience signs and symptoms other than bleeding related to the AVM. First, we are going to talk about causes, which they haven't really found a specific or clear cause of this malformation, but it is thought that it's because fetal development. If we talk about symptoms, we have seizures, headaches, and muscle weakness. But some people may experience more serious signs and symptoms like vision loss, difficulty speaking, confusion, and severe unsteadiness. Now, about the treatment, we have two ways: prevention of the AVMs and interventional treatment. Here we have like microsurgical techniques, endovascular embolization, and stereotactic radiotherapy. Here's a video of the symptoms we
AVMs
can
can
have.
form anywhere in the body. They most often form in certain parts of the body, like the brain, the spinal cord, and the lungs. If the AVM ruptures in the brain, blood escapes into the surrounding brain tissue. Sometimes the blood loss can be small, called a microbleed, which doesn't typically cause much damage. But sometimes when blood loss is severe enough, people might experience what's called an intracerebral or subarachnoid hemorrhage. Depending on the location, this can cause several neurological complications, like headaches or seizures, as well as other neurological symptoms that can relate to the part of the brain affected. Like, for example, if it affects the hippocampus, it might affect the person's memory, or if it's the basal ganglia, it might affect their ability to move. In the spinal cord, AVMs can, by the same mechanisms, damage nerve fibers, which can cause sensory disturbances, muscle weakness, or even paralysis in the parts of the body controlled by the affected nerves. In the lungs, an AVM might result in shortness of breath or coughing up blood. It's also important to remember that having blood flow out of the heart to an artery, then through the AVM to a vein, and directly back to the heart is a lot of wasted work, since that oxygen's not going to the tissue's capillaries like it should, and it's just rerouting back to the heart, which ultimately causes the heart to work harder. And over time, an AVM can contribute to heart failure because the heart's doing extra work with each beat. Diagnosis might involve several imaging techniques, one of which is angiography, which is actually the gold standard, but others are CT scans and MRI. Aside from imaging, a distinctive clinical sign of an AVM is a bruit, which is French for noise. When blood flows rapidly through the AVM, it causes a whooshing noise. Sometimes this noise can get so loud, especially if the AVM is in the brain, that the person can hear it themselves, which can cause serious psychological stress, not to mention making it hard to sleep or hear other things. The cause of AVMs isn't well understood, although it's thought to be congenital and caused by some mistaken blood vessel growth during embryonic or fetal development, some of which seems to be genetic. One well-known relationship is with Osler-Weber-Rondeau disease, which is an autosomal dominant disorder that causes problems with blood vessels throughout the body. Most AVMs are treated even if the person's not symptomatic, because of the risk of complications like bleeding. Medications can be used to treat certain symptoms from an AVM, like headaches, but also they might have certain procedures, like radiosurgery, where beams of radiation are targeted at the AVM, causing the vessels to scar and close off. Or they might have endovascular embolization, where a catheter is used to obstruct the vessels.
Okay, now that that's well explained, we're going to talk about pros and cons. Like we said earlier, it depends on the patient. The patient outcome depends on the location of the AVM and severity of bleeding. If we talk about pros, we can say that pros about the treatment. Surgery to reduce nidus volume and cure an eventual additional vascular anomalies, like for example an aneurysm. You have opportunity for immediate removal of the AVM. Like it is congenital, it may be removed with minimal disruption of normal brain tissue. In a study in Aruba, unruptured brain AVMs lower chances of death or stroke in medical management. For medical management, we mean treatment by symptoms than the interventional therapy, like microsurgery. Here's a video of a surgery with endovascular embolization. it reached the brain, and now the AVM blocking its way so blood flow can irrigate with no obstacles. Then again, we have normal blood flow. It is removed, like in any procedure. We have cons. First, we have highest chance of obliterating the lesion and risk of bleeding or other neurological symptoms, including seizures or focal deficit. Now, if we talk about statistics of AVMs in Ecuador, we have a total of 41,375 discharges by congenital malformations were registered in a 7-year period. In a study registered in Luis Vernaza Hospital, 4 of 19 patients with etiologies of cerebral infarct had AVMs. To conclude, given that AVMs shows no signs or symptoms until the blood vessel rips, it's hard to notice when you've got one. To prevent the situation, it's important to attend to a specialist just to confirm everything's in order. In case of having AVMs, interventions are highly recommended, so you shouldn't give up without even trying. Here is a statement of a survivor of an AVMs.
The first thing that brought me to Mayo Clinic was recognizing that something was not right. I was having headaches on a daily basis. The headaches were so debilitating that I think that they had an effect on my memory. It was terrifying. This one right here.
Nicole had a lesion that was located in her dominant hemisphere. So one of the main concerns in Nicole's case was the lesion is in a highly important area of the brain. When the bleeding happens, it's a high pressure bleed and can cause a lot of damage. The mortality is up to 15%, and the morbidity from that, people becoming disabled, is much higher than this.
I have the 7.5-year-old. Her name's Lydia. My worst fear was not being able to see Lydia grow up.
AVM are very rare. As a physician, as a one person, you have an idea about how to treat the patient, but it's safer and it's better for patients to pull more thoughts into the treatment plan. And that's why it's essential to have a conference between colleagues. In Nicole's case, we had multiple treatment options, but every specialist thought that the treatment for this was surgery.
The outcome, it couldn't be guaranteed, but I trusted them fully. I did everything I could to try to prepare Lydia. I knew we were facing quite a battle. I created a memory box so that she would have something tangible, knowing that I was thinking of her during the whole thing. She and I read together every night. A warm, supportive place. One of the things that I put in the memory box for her was a book that I recorded reading to her. A prayer to your guardian angels, angels of God, so that she would have that. Bright sunny days, deep wishing wells, sparkling blue oceans, and a winged messenger inspiring you with happy notions.
Anytime you're doing surgery, there is risk. There is no surgery that is zero risk.
When you look up into a crystal clear night sky and an awesome shooting star catches your searching eye, attach your dream to that star.
You need a high level of skills, you need a high level of expertise, and you need an institution where the focus is the patient.
For your mind and your heart, and warm, supportive friends to help you.
As a surgeon, I feel very happy to see patients where I make a difference in their life. But the patient's outcome after complex surgery does not depend only on a specific surgeon's skills. It depends on a chain of skills that are needed from start to end.
Ever this day be at my side. Amen. That's a sweet book. Today, when I think back, I think of how I'm incredibly blessed. I have not struggled with headaches. I'm not on any medication. I'm incredibly grateful. I hope for other people is that they're able to see that there's hope, that the Mayo Clinic can help, and that you're not alone.
The end. Thank you for watching.